Obviously, every vote matters to Republicans as they try to advance this piece of legislation. The Mayo Clinic, where he was being treated over the weekend, has this statement, which we got from the office of Senator John McCain. Quote, surgeons successfully removed the 5-centimeter blood clot during a minimally invasive craniotomy with an eyebrow incision. Tissue pathology reports are pending within the next several days. The senator is resting comfortably at home and is in good condition. His Mayo Clinic doctors report that the surgery went very well and he is in good spirits. What's the latest that we know on the senator, whom we wish well, and also about what he means, what his health means, his involvement means for the passage of this piece of legislation, Sahil?
Well, David, it's certainly good news for the senator in that the surgery went well, and it looks like he'll make a recovery. Now, as for the health care bill, it was supposed to be voted on this week. Senate Majority Leader Mitch McConnell had wanted that. He had said that several times, but he has no more votes to lose. He already lost 2 senators right out of the gate, Susan Collins from the moderate wing and Rand Paul, the ultra-conservative senator from his home state of Kentucky. He cannot lose any more or the bill is dead. He can only, his margin for error is 2. He needs to hold all the other 50. So without Senator McCain around, who's going to be out resting this week, according to his office, resting at home in Arizona, Republican leaders do not have the votes to move this bill even to debate, let alone to a final vote. So Senator McConnell has delayed consideration until after this week, and they plan on working on other things this week, David.
We await the return of the senior senator from Arizona. We also await the new report from the Congressional Budget Office on this piece of legislation. That's been delayed as well. How important is that going to be for the leader, for Mitch McConnell, to make his case to his colleagues?
Very important. I mean, this stuff is what the conference and members are going to be judged by. They're going to be hearing a lot about this at home. What number, how many millions of people does it leave uninsured? Now, one important thing there, David, is to see for us to be able to look at the impacts of the Ted Cruz amendment. We know that this allows insurance companies to, across the country to sell skimpy and cheap plans at a lower cost. The CBO has standards as to what it considers real coverage and insurance plan, because if if you have a catastrophic policy that, for instance, doesn't cover if you get hit by a bus or something like that, that still leaves you on the hook for medical bankruptcy. So it's not clear how much of that coverage of the skimpy plans added CBO is going to consider. So yes, this is absolutely an important, an important milestone because you have several senators who are still holding out. They're not no's yet, but they're not yeses yet. They include Dean Heller of Nevada, the most vulnerable Republican senator up for re-election in 2018. It includes Lisa Murkowski of Alaska, who is generally in the more moderate wing of her party, and includes Shelley Moore Capito and Rob Portman of West Virginia and Ohio, respectively. McConnell needs all of these votes to get this across the finish line, and I think that CBO score is going to weigh heavily on these senators.